Hello YouTube, Dr. Tahir from Youthful Medicine. So today I'm going to talk to you guys about something that a lot of my patients who have been with me for about 2-3 years for weight loss treatment have come to a point that they want to know, and I want to know, when is a maintenance therapy the right word to use versus could say that we can actually get rid of the medication. Just to give a background, about 2.5 years ago, we started using Wegovy, which is the semaglutide, and then Ozempic, which was the same medication for diabetics. And then a year and a half into now, I believe we have Tirzepatide, which is Zepbound for weight loss treatment, and we have the same product as Manjaro for diabetics. They both help our patients lose weight, reverse metabolic diseases, reduce obesity. The burden of disease that we have in our country is enormous, and we do need to do something about it. But there are some success stories. I mean, there are many success stories in my practice, and I usually tell patients, look, I'm going to start with you. I have some patients who are BMI and 40, some patients who are BMI between 30 and 40 range, and some are actually 27 with comorbid conditions of BMI or 27 and more, and then we start to kind of see who is the right candidate for the patient. But once we select the right patient, the right medicine, and follow up along with diet, lifestyle, making sure they're getting the exercise, the nutrition they need, mental health support they need, we then achieve our goal weight. And you may not believe, but I have many patients who are now in a BMI which we consider a healthy range BMI, and I consider the target of the BMI to be 23 because we have range where we see 22 BMI, 23 BMI, I think is really ideal for a lot of patients. I do want to make sure that my patients are doing strength training 2 or 3 days a week, and cardio 2 or 3 days a week, and some relaxed walking, yoga, and something of that nature. They have to be active. They have to take enough amount of protein. I prescribe about 1.2 range between 1.2 to 1.5 grams of protein per kg body weight. And when my patients reach to a BMI goal of 22, 23, I decrease their dose. If they are on a higher dose, taper it down slowly, and then maintain it a middle level, moderate level of dose, so that they can remain in this healthy range as they work on their lifestyle, as they work on their nutrition habits, as they work on their mental health. In addition to that, I usually tell them to make sure that, if possible, we do a bone density DEXA scan, which is the body composition scan. It's the same scan that is done for patients who have osteopenia, osteoporosis, but there's a special type of setting in this test which can be adjusted to assess for your body mass. So it will give you a body mass muscle based on your age, sex. It would also give you your visceral fat, your total body fat, and I think it's a very useful test. So again, when is the sweet spot for every patient depends on their body frame, their body composition analysis, and their ideal body weight, where they feel that they can actually function and have a good quality of life. So again, think about your goals when you are working on your weight loss treatment. Talk to your doctors about it, but make sure that there are 4 pillars of obesity medicine treatment that you should be looking at, which is your nutrition, your lifestyle, your mental health, your physical activity, and your medications. Okay, all right. Until next time, take care.